Antimicrobial prophylaxis. High risk includes endocarditis, surgery, dental procedures, amoxicillin, exposure to gonorrhea, ceftriaxone, history of recurrent UTI, TMP SMX, trimethoprim and sulfamethoxone, exposure, meningococcal infection, ceftriaxone, ciprofloxacin and rifampin. Pregnant women, it is positive is galacteus, GBS. Intrapartum is penicillin, ampicillin. Prevention of meningococcal conjunctivitis in children is cefazolin. Prophylaxis of Streptococcus pharyngitis in child prior to renal failure is benzathine penicillin G or PO penicillin V. Exposure to syphilis is benzathine penicillin G